Hi, I'm Dr. Joe Frankhouse, a colorectal surgeon with Legacy Health. We understand that people are usually eager to get back home after their recent surgery. We strive at Legacy to get you recovered from your recent surgery quickly and efficiently and safely. With that said, we've put together a series of videos to help you understand what to expect and to help you recover as optimally as possible after your recent surgery. We understand, however, that the patient who is educated, healthy, and fit is going to have the least chance of having any complications and will more likely have a quick and efficient recovery. To help you take care of yourself at home, we have developed a series of videos. It will cover the following topics: diet, surgical site care, symptoms of concern, bowel movements, activity, medicines, and if applicable to you, ostomy care, and resources for cancer patients.
I'm Linda. I'm one of the dietitians here at Legacy Good Samaritan Hospital. Today we're going to talk about your nutrition postoperatively. It is recommended that you follow a soft, low-fiber diet for the first week after surgery to help with the ease of digestion and tolerance. A soft, low-fiber diet can consist of white breads, white rice, white pastas, also hot cereals such as cream of wheat and cream of rice. Steamed cooked vegetables is also allowed on the diet, such as steamed broccoli, cauliflower, asparagus. Peelable fruits such as bananas, apples, peaches, and pears, and melons are all peelable. You want to avoid grapes and berries at this time, as those are a little difficult to peel. Protein is an important part of the diet. You can choose chicken, pork, fish, eggs, and ground beef. Fats that you can also use are going to consist of butter, oils such as canola oil and olive oil. Nuts are acceptable on the diet as well, as long as they're in smooth nut butters. You're going to want to avoid whole nuts at this time. About a week after surgery, you can start incorporating high-fibered foods back into your diet, such as choosing a small apple or a small side salad. If you tolerate that well, the next day you can start increasing a little bit more into your diet by adding possibly 2 pieces of fruit or maybe a larger salad. Some tips to help increase nutrition after surgery: you can try eating small, frequent meals to help increase your tolerance. You can also use oral supplements such as Boost Ensure type drinks. You can also supplement with kefir to help rebuild the healthy gut bacteria. If you have an ileostomy or a colostomy, further diet information will be provided to you at the hospital. If you have further questions, please contact the dietitian while you're in the hospital, and a phone number will be provided to you.
Hi, I'm Michelle, and I'm a nurse here on the oncology unit at Legacy Health. Today we're going to go over the care of your incision at home. Always wash your hands before touching your surgical site. Touching or handling of your surgical site should be kept to a minimum. Wear clean clothes and underwear daily to prevent infection. Start with clean bedding and sheets when you get home, and wash your bedding and sheets at least once a week to prevent infection. Pets should not be allowed near the incision for at least 2 weeks. Regarding the care of your wound, it is okay to shower at least 3 days after your surgery. However, there are important surgical site care instructions to remember. Your surgical site may have steri-strips, as seen here, epidermal glue, or staples. It's okay to allow lukewarm water to wash over the steri-strips, epidermal glue, or staples. Do not pull off the strips or the glue, don't pull at the staples, and don't scrub the site. Gently pat the site dry after your shower, taking care not to place pressure on the surgical site. Allow the strips or the glue to fall off on their own over time. Staples will be removed by your doctor at your next appointment. Cover the surgical site with gauze or a bandage if it's still moist, or for comfort. Change that dressing daily or when it gets wet. Once the surgical site is dry, it's important to leave it open to air to promote healing. If you have any questions regarding your incision or wound care, feel free to contact your doctor's office. Thank you very much for your time, and I hope you heal well.
Hi there, my name is Elisa Rotramel and I'm a colorectal surgeon here at Legacy. Getting ready for surgery can be pretty overwhelming. We do our best to help you prepare and understand what to expect before, during, and after surgery. Before you go home, your team will review your plan of care, including medications and instructions for when to call your provider. I will go over that specifically with you here today, when to contact your surgical providers for help and advice. Please note that if your surgeon has given you specific instructions, you should review and follow them. Also, if you experience severe symptoms, including worsening pain, chest pain, shortness of breath, you should contact your provider, and if you are not able to do so, dial 911 or visit your nearest emergency room. After your discharge from the hospital, you should watch for signs of infection, particularly by monitoring your incisions. Worrisome signs include increasing swelling, pain, redness, drainage, or bleeding from your incision. Another sign of infection is a fever of over 101 degrees. Even if your incision looks perfect, these all can be concerning signs for a wound infection and should prompt a call to your provider. After bowel surgery, it takes some time for your appetite to return, and your bowel habits may have changed. It's very important that you eat and drink enough to stay hydrated and to get the proper nutrition you need to recover after surgery. Remember, your doctor may have given you special instructions on a diet to keep after surgery. If that's the case, be sure to refer to his or her instructions. A common cause of nausea is strictly from the pain medicines you're taking after surgery. Opioid pain medicines commonly cause nausea and should not be taken on an empty stomach. Be sure to take even just a little bit of food before you take these medications, as this can help immensely. However, if you are experiencing worsening bloating, abdominal pain, nausea, vomiting, or having trouble with bowel movements or passing gas, please do call your doctor for instructions or visit your nearest emergency room for evaluation. As we discussed before, you most likely will see some changes in your bowel habits after surgery, either going more frequently or changes in consistency. They may be much more loose. However, if your bowel movements consistently become more watery or you're having more diarrhea, this should prompt a call to your doctor. Ongoing frequent loose stools or watery diarrhea can sometimes be treated with medications, but other times they may be signs of a colon infection. If these symptoms worsen or don't continue to improve, please call your provider for further instructions. Some changes in your bowel habits are absolutely normal after surgery, and patients frequently will see a little bit of blood in their stools in the first few days after intestinal surgery. However, if you experience new or worsening bleeding, please call your provider for further advice. Most patients are able to take smaller and smaller doses of prescription pain medications and eventually are able to stop them over the first week or so. You may also take other pain medications such as ibuprofen or Tylenol, which are non-narcotic pain medications that can also be very effective. However, if your doctor has instructed you not to take ibuprofen or Tylenol for another reason, please do follow their instructions. If you are experiencing worsening pain or find yourself needing larger amounts of medications for pain control, please do call your provider to discuss further instructions. We wish you a healthy and speedy recovery. We do hope that this will be a good resource for you, but do not hesitate to call if you have any other questions or concerns. In addition, if you do have access to My Health, you can send us messages about non-urgent questions such as refill requests, etc., and those will be answered electronically. Thank you for listening, and please remember, before surgery, during surgery, and after surgery, we are here to help you.
Hi, I'm Dr. Brent Evitz, colorectal surgeon at Legacy. I'm going to talk to you today about how your bowel movements can change after having had recent colon and rectal surgery. After having had surgery on your colon or rectum, it's not uncommon to have changes in your bowel movements. This usually occurs due to the changes in the anatomy that occurred after surgery. Most patients who have a portion of their colon removed have minimal long-term changes in their bowel movements. When you compare that to patients who've had a portion of their rectum removed, they are more likely to have changes that affect bowel movements and are longer lasting. The good news, if you do have changes after having colon or rectal surgery, they are usually temporary and can usually be managed with diet, fiber, or sometimes medications. Initially, the first bowel movements after surgery sometimes can have a little blood with them. This is not uncommon and usually passes fairly quickly. It is important, though, that if you should have a lot of bleeding after surgery, you contact your surgeon and let them know. Common alterations in bowel movements after colorectal surgery include the following. It's important to remember that the changes that can occur are varied and can vary with each patient. Clustering of bowel movements. This is having several bowel movements over a 2 to 3 hour period, then none for the rest of the day. Frequent stools throughout the day. Changes in the consistency of the stool. Urgency. Erratic bowel movements. This is a common complaint in which a patient will have one or no bowel movement in a day, followed by a day with several bowel movements. The feeling of incomplete emptying, or you may have the feeling that you need to still go. It's not uncommon to have difficulty telling the difference between gas and stool. Occasionally, some patients will experience episodes of incontinence, but this is very rare. Changes that occur in bowel movements after colorectal surgery can be frustrating. It's important to remember that they will likely improve over time. It's also important to remember that your bowel movements will not be the same as they were prior to surgery. This is due to the changes in the anatomy that occurred due to your surgery. Your body will adapt, you will adapt, and a new routine will become normal for you. Don't be afraid to discuss any concerns you may have with your surgeon. It's important to remember that there are often recommendations that can be made to help alleviate any of the problems you may be experiencing. I hope this has been helpful, and good luck in your recovery.
The first couple of days after surgery, you will be sore, you will be tired. However, you won't be bedbound or homebound. You're allowed to get out. You're allowed to do things. You might need help at home, however, with things like cooking, cleaning, or running errands. What about pain medicine and activity? Generally, it is important to take your pain medicine before becoming active. Remember that narcotics do make you sleepy and can decrease your reaction time and coordination. There are other medications that will not do so. Medications like ibuprofen, naproxen, which is otherwise known as Motrin, or Aleve. These can be taken before activities to diminish the amount of pain that you would otherwise experience and still allow you to get active and help you recover. It's important to recognize that your activity can be tailored to your comfort level. There is no danger in becoming active as long as you're not suffering with pain. Walking is probably the best exercise to help you recover from your recent surgery. It can be done almost anywhere. Walking outdoors is probably best. However, if the weather is bad, one can stay indoors and walk on a treadmill, or go to the local mall and walk there. It is to be expected that your walking will be a shorter distance than before. Your stamina won't be as much as it was prior to the surgery. You can tailor the distance or time walking based upon your strength and energy. I would rather you go out for 2 or 3 short walks per day than try to do one long walk. It is best to walk on a nice level surface as opposed to rough terrain. Your balance and core strength may not have recovered. When it comes to bicycle riding, I think it is best to at first use a stationary bicycle. In that way, one does not need to worry about city traffic or core strength to maintain balance. This will allow exercise that is an equal alternative to walking and can be easily done. Wait until you've regained strength before actually getting on a bike and heading outdoors in our city streets. Many homes and local gyms have other exercise equipment. These can easily be used. In general, however, I find at first walking on a treadmill or using a stationary bicycle is easier and puts less strain on the abdominal wall. Other kinds of exercise equipment, like stair-stepping equipment or elliptical trainers, do put more stress. I would ordinarily recommend You wait until you have tried bicycle riding and walking and feel comfortable with that before trying these other pieces of equipment. However, ordinarily, within 2 or 3 weeks after surgery, these kinds of exercises are safe. Again, comfort is the key. If you feel comfortable doing it, it is fine and it is safe. Swimming after surgery. Swimming in general is an excellent exercise. However, with your recent surgery, it's important to let your incisions heal first. Ordinarily, it takes about 2 weeks before it's safe to get into a pool. It might be best to ask your surgeon. However, after 2 weeks, assuming your incisions have healed, it is fine to begin swimming and using that as a good exercise to recover after surgery. When it comes to lifting after surgery, it is important to recognize that it is comfort that is the key. For some patients, they may only be able to lift up to 10 pounds without causing discomfort in their incisions. And yet for others, they may lift up to perhaps 25 pounds and be perfectly comfortable. It depends on your strength and the way you are lifting things. So again, it is comfort that guides you. In general, we say that between 10 and 25 pounds should be your maximal lifting. You might need to alter the way you lift things or change your activities in some way, but let comfort guide you. You were given an incentive spirometer to use in the hospital after your surgery. It is best to take this home with you and use it there as well. During the first week, or until you've regained your normal physical activity, it is best to use this a few times per day to exercise your lungs and help them expand. This can reduce the incidence of pulmonary problems or pneumonia after surgery. Driving after surgery. This largely depends on your recovery and need for narcotics. It is important to recognize that if you've taken narcotics within 8 hours of driving, you should not be driving. It's also important to realize that you must be able to put on a seatbelt safely, you must be able to get in and out of the car comfortably, and you must be alert. If you cannot do these things, you should not be driving. For some people, they might be able to drive as soon as 3 to 5 days after surgery, and for others, it could be up to a month. Thank you for choosing Legacy Health, and we are all hoping they will recover as soon as possible.
Hi, I'm Kelly, and I'm a hospital pharmacist at Legacy Good Samaritan Medical Center. Today I'd like to talk to you about some of the medicines that you'll be going home on after you go home from the hospital after your bowel surgery. The first group of medicines I'd like to discuss is your pain medicine. It's important to stay pain-free after surgery. Decreasing or eliminating your pain is important for a number of reasons. Being pain-free boosts your immune system, helps your appetite, it will help you sleep better, and it will get you back on your feet and moving again. You'll be given a prescription when you go home from the hospital for pain medicine. This medicine will contain an opioid or a narcotic. Examples of these medicines are oxycodone and Lortab. You probably received these pain medicines or something similar while you were in the hospital. So let's talk about how to take the pain medicine. You should only take your narcotic pain medicine when you experience pain. Don't take it automatically, just 3 or 4 times a day if you have pain. As you get further out from your surgery, your pain should start decreasing. If it doesn't, you should call your surgeon. Your need for narcotic pain medicine should become less and less within the first week or so after surgery. If you've been using the pain medicine more than a week, it's wise to taper down over a few days. But this does not mean you are addicted. It just means your body needs a few days to adjust to having less pain medicine around. You can taper down your pain medicine by just taking 1 tablet instead of 2, or just take a half a tablet instead of a full tablet. Everyone is different. Some people do not need any narcotic pain medicine after surgery, while others may need it for a week or 2 after surgery. In addition to your narcotic pain medicine, we would recommend that you also use non-prescription or over-the-counter medicines to help relieve your pain. Examples of these include acetaminophen or Tylenol and ibuprofen, also known as Advil or Motrin. Our general advice is to use Tylenol 1,000 milligrams 3 times a day. We also recommend taking the anti-inflammatory medicine called ibuprofen 600 milligrams 3 times a day. The Tylenol can be taken at the same time as the ibuprofen. If you prefer, another anti-inflammatory medicine called naproxen or Aleve can be used instead of the ibuprofen. But don't use both ibuprofen and naproxen together, as they are very similar medicines. When you feel that you do not need your strong pain medicine or narcotics any longer to relieve your pain, you can just use the over-the-counter pain relievers as long as is necessary. We would not recommend taking Tylenol if you have severe liver problems, and we would not recommend the anti-inflammatories such as ibuprofen or naproxen if you have severe kidney disease or a history of bleeding stomach ulcers. Another important part of taking narcotic pain medicine is to avoid constipation. These medicines can cause constipation. Our goal is for you to have 1 bowel movement a day. As long as you have at least 1 bowel movement a day, you don't need to take any laxatives. If you stay well hydrated after surgery and eat plenty of fruits and vegetables, your bowels should work just fine. But if they don't, or if you miss a day or two, you'll need to take a laxative. We recommend either generic Miralax or milk of magnesia, taken once or twice a day. You should continue one of these medicines until a bowel movement occurs. Your surgeon will generally advise you prior to your hospital discharge whether or not you need to routinely take anything else to keep your stool soft. If you go several days without having a bowel movement, or if you begin experiencing increased abdominal pain, you should contact your surgeon's office. Remember, after surgery, it's important to stay pain-free. Take your narcotic pain medicines only when you need them, and be sure to routinely use the over-the-counter medicines that we talked about. Avoid constipation by eating a healthy diet, and use a laxative as needed in order to have 1 bowel movement a day. If you have any questions at all about the medicines that we've talked about, be sure to talk to your pharmacist who fills your prescriptions, or there's pharmacists in the hospital that would be glad to talk to you before you go home. Thanks for listening, and best of luck on your road to recovery.
Hi, I'm Sue Wilson. I'm one of the registered nurses that works on the wound and ostomy team here at Legacy Health. We are a certified group of nurses who specialize in wound and ostomy care. While you've been here in our hospital, we have been teaching you how to take care of your new stoma. We have showed you different appliances, maybe a 1-piece, maybe a 2-piece. We have shown you an Eakins ring to help protect the skin around your stoma from the stool. We may have even given you a belt. We will give you an individualized discharge plan so that you will be able to refer to that when you're in your home setting. We will also give you enough supplies for 3 weeks in your home. We will then have the 3 main manufacturers send you some samples so that you can try each company and decide which works best in your life. Then we would love it if you would call us in 2 or 3 weeks and schedule an outpatient appointment. We would be able to help you with any concerns or issues that you may have and help you decide on which appliance you wish to use in your home setting. We'll send a prescription to a durable medical equipment company, and they will send you your supplies via UPS. They will also charge your insurance company for you. Remember, it's really important to eat and drink with this new stoma. We recommend multiple small feedings throughout the day. This helps you manage your output from your pouch. It also helps with your absorption of nutrients. It's really important that you chew well and you eat slowly. We recommend 10 to 12 8-ounce glasses of water per day, or fluid of any kind. Another way to look at this is if you are emptying out your pouch, you need to drink a little bit more from what you're emptying from your pouch. If the output is more than what you can keep up with, it's important to notify your physician. We are here to help you with any questions or concerns that you have. Please feel free to call at any time. We want to make this transition as easy as possible for you.
Hi, I'm Utah Kress, Oncology Nurse Navigator for the Legacy Cancer Institute. Legacy is committed to serving our cancer patients. If you've been given a cancer diagnosis, we have many support services available to you. Each of our hospitals have access to the Oncology Nurse Navigators. Our navigators are registered nurses who have specialized training and certifications in cancer care and take a special interest in caring for our cancer patients from diagnosis through and into survivorship. Our Oncology Nurse Navigators are there to help you learn and understand about your diagnosis, review information given to you by your physicians, and provide you with access to resources and support services available to you. We understand with a cancer diagnosis, practical issues may come up. We can help you with our American Cancer Society Patient Navigator with issues such as transportation, lodging, and sometimes access to additional funding. If you have not been contacted by an Oncology Nurse Navigator, please call 503-413-8888 or ask your physician to place a referral and an Oncology Nurse Navigator will contact you. Legacy is proud to offer the services of a nurse practitioner to help our cancer patients with symptom management and integrative care. Our nurse practitioner can work with your physician to incorporate Eastern and Western medicine in efforts to provide you with holistic care. The nurse practitioner can talk to you about the use of herbs, supplements, acupuncture, and other integrative support services. The nurse practitioner can offer you choices and make recommendations for nutrition, exercise, and screenings in efforts to prevent future cancers. The nurse practitioner is located in the same clinic as our other cancer support specialists. They include our oncology dietitian, social worker, genetics counselor, and many other therapists. They, along with the nurse practitioner, can be reached at 503-413-6550. Many of our patients enjoy the support they receive through our support groups, movement classes, and education classes. These classes are all directed at helping you move through and beyond your cancer diagnosis. Your navigator can help you access any of these support services. You can also get more information on these services and more at our website. Thank you for choosing Legacy Health for your healthcare needs, where our legacy is good health for our people, our patients, our communities, and our world.